Good morning. Welcome to Geneva and to the 2026 World Health Assembly. My name is Chris Lynch and I am the acting CEO at Alzheimer's Disease International, ADI. And it is my absolute pleasure to welcome Dr. Tarun Dua. She's the unit head for non-communicable disease and mental health here at WHO. Tarun, welcome. Thank you for joining us.
Thank you, Chris, and my pleasure to join you today and talk about dementia.
Oh, wonderful, wonderful. So it's a poignant day for us, World Health Assembly always is. We are launching today our From Plan to Impact report. This report we bring out on the anniversary every year of the Global Action Plan on Dementia. And this year is a really succinct infographic-based report. And it's just 4 pages. It's going to be available for download from today going forward. And it really is just a snapshot of where governments are in terms of the development and deployment of their plans. But we're always really keen to do this in terms of how we work with you and on all of the stakeholders, because you've reminded me time and time again that even though WHO are the creators of the Global Action Plan, we're all responsible for delivering it. So having gone through the extension last year to 2031 and also getting dementia into the NCD UN declaration as well, we thought this would be a perfect opportunity just to ask you a few short questions, if that's all right.
That's great, and congratulations on launching the report.
Thank you.
It's looking very nice. I was reading through it in the morning, and the infographic is really telling a story.
Yeah, it really is, isn't it? You can see the change and the momentum that's starting to happen now. And, well, look, let me dive in and ask you a few questions. So we're 1 year on from the extension to the Global Action Plan, and how would you describe that overall progress?
The extension of the Global Action Plan last year, I think it provided a renewed momentum, and that was needed. When we looked at the achievement of the targets, we were very much far behind. And one of the major things that we are all proud of, and I think it is extremely important, is the UN Political Declaration on NCDs and Mental Health in last year in 2025. It provided the strategic agenda. There was explicit inclusion on, you see mental health in the title. You read about dementia and the integrated system-wide approach that is needed. So that's one thing, where we are. And I think that's political prioritization, strategy setting is extremely important. And then the commitment of translating innovation into action.
Yes.
I think in our lifetimes, we are at the stage where we are looking at the innovation in diagnosis, we are looking at innovations in treatment, and for us as WHO is that how do we get these innovations at scale to people who need the most and where there are inequities, right?
I totally agree, and you're hitting on something that's, I think, incredibly poignant for us, which is this implementation gap at the moment. What's the bridge in terms of getting from really strong policy into this implementation space?
So, as I translate this into 3 things. There are countries that have policies, that have plans or dementia strategies, and they're doing something about it, right? Which is really good. But we also note that they need to do more. Many of the countries, they have new plans and they update their plans, which is good. Then we have some other countries which do have plans, but there is a lot of implementation gap. And then we have countries where there are no plans that are existing. Now, the point that I would like to emphasize here is that we talk about standalone plans, when most of the time we think about standalone dementia plans. But in today's world, there are lots of entry points.
Yes.
We already talked about the NCDs, non-communicable diseases. That's an entry plan. In many countries, dementia is part of mental health. That's an entry point. Then we also have aging, right?
Yes.
So we do have the gap to bridge that implementation gap is through integration.
Yes.
The second way to bridge that gap is through health system strengthening and looking at workforce at community level. The reason being that we are lacking specialists. You know, if, for example, if you look at the number of neurologists in high-income countries, let's say it is 3 per 100,000. In low-income countries, it is 3 per million.
Yes.
There are huge gaps. And when we are talking about a condition like dementia, the community mobilization, the community strengthening of community health workers is very important, because a person with dementia is not often going to come to the health facilities. We need to go
to
them. That's extremely important. And third, and the most important thing, and where actually ADI plays an important role and can play a further role, is in terms of addressing the the awareness gap.
Yes.
And that's a major part of the implementation gap, because if you don't know you can do something about it, you're not going to do it.
Yeah, I totally agree. Tyrone, you make such a good point about awareness raising. And for the last 10 years, ADI has been doing this awareness and attitude to dementia survey, which we're starting to see, there is perceptual change as well, but it needs to be at absolutely every step of the way, not just in the general population, but with the healthcare practitioners. And it made me think something that came up quite strongly from the report this year was about 25% of countries now have a dedicated standalone plan. There's another 20 in development. But you hit on something really important, which is this integration. I think if you'd asked me this 7 or 8 years ago, we'd have been very entrenched and said a standalone plan is the best tool available. But in reality, it has to be integrated. And I think what happened in New York last year at the UN with the new declaration with NCDs has opened up an entirely different opportunity for us, particularly around risk reduction. Can you tell us a little bit more about how that declaration is going to prove useful in the dementia space?
Right. Now, that's a very important point. When we think about dementia, and we are at that age, right, Chris? We want to think about preventing dementia, reducing the risk of dementia, and we all think about it, even if we don't say it. I'm saying it on camera. You may not say about it, right? And as you know, many of these risk factors are NCD related, like diabetes, hypertension. Then some of the NCD risk factors and dementia risk factors are shared. If we talk about obesity, or we talk about physical inactivity, right? So there is, I think, this UN declaration and otherwise, it tells us that we need to reduce the risk of dementia, and working on these NCD risk factors, interventions for reducing the risk of NCD risk factors will help us in reducing the risk of dementia. And this is important because in 2019, WHO has come out with their first ever guidelines on dementia risk reduction. And I'm very pleased to tell you that we are updating our guidelines, looking at new risk factors, new evidence, and we would be launching them in a couple of months. So stay tuned to see what countries should be doing, what civil society should be doing, because then there are other risk factors that are important, like, in terms of your cognitive stimulation, air pollution, social connection.
And there's a really good bit here for policy that we're finding is, so when we're talking to ministries of health, there's often a level of intimidation around dementia and the potential cost of it. But when you open the conversation with risk reduction and talk about potentially preventing or delaying 45%, all of a sudden the conversation's moved into a proactive, positive area, and it's a really good door opener.
Exactly. So we talked about integration, and this is our kind of like the second point that I would like to make is the entry point, right? The risk reduction provides us an entry point for that integration that we talked about.
Perfect. Look, if I can, let me deviate very slightly, because in the Global Action Plan, one of the core areas is capturing the voice of people living with dementia and equally of carers as well. For us, what we've found over the years is that that's not about validation. It's about involvement right from the very beginning. And from WHO's point of view, what's the kind of the value and the mechanism for capturing that lived experience?
That's a very important point that you are making. You know, we say that nothing for us without us, nothing for them without them, and it should not be a tokenism. And that's what WHO firmly believes in, and that's kind of as an embedded as a principle of the work that we do, not only for dementia but for other disorders. So, for example, we have a framework on engagement of people with NCDs and mental and neurological disorders.
Yes.
So something that is very extremely important. And I think what we need to, when we think about engagement, is that they are engaged from beginning to the end. They are from the design to implementation to monitoring. And that participation, again, coming back to that tokenism, it has to be decided a priori. It has to be formalized.
Yes.
There has to be, for example, they have to be and there has to be some transparency. There has to be an accountability. And last point that I would make, that we need to build the capacity of policymakers on how to better engage.
Yes,
because very often we talk about, build the capacity of people and their families to engage with policymakers, but also we need to tell policymakers how to better engage. Right?
Completely agree.
And we have we do this, I talked about my guidelines and start with that. We have people living with dementia and their caregivers as members of our guideline development group. The audience would know about our Global Dementia Observatory, where we have our data platform, our knowledge exchange platform, and we have people living with dementia and their caregivers as peer reviewers. So they review everything that is put on that platform. In fact, our the iSupport, the caregiver support tool that we have is all about for caregivers. So many examples. I mean, like even the plan that we developed, we heard the voices. So as I said, they are part of the whole process, part of the journey.
The entire journey. And I think what we're finding as well with capturing that experience, that expertise, is you can see a change and a transition from a heavily stigmatized area. And now we're moving into a space of proactivity, and obviously now with some treatments and new diagnostics, there's an attitudinal shift. So I'm hopeful that capturing that voice is going to become easier.
Exactly.
But I'm going to ask you one more question, if it's okay.
But before,
no, please go on.
I actually wanted to emphasize another thing, is participation in research. Very often when we talk about research participation, it is about, because they are the kind of the people, for the clinical trials and biomarkers, but how are they part of those research agenda setting?
So look, my final question is probably the policy galvanization momentum question. We're a year into the 6-year extension. How do we, as a stakeholder group, galvanize that, the governments around the world, but all those key stakeholders? So in 2031, when we look back, we can genuinely say, we did make a big leap forward and we used this global plan to the best of its ability.
So I think, Chris, as I see it, the important thing is no one stakeholder can do it alone. So the important thing is that we need partnerships, we need collaboration, and we need coordination. I think that's an important message, and everybody has to work towards that common goals. And we have the targets. The action plan has come up with the targets. The global status report on the dementia and the and the GDO data, the Global Dementia Observatory data, tells us where we are. For example, the last round when we collected the data from the countries, only 100 countries submitted their data. Now you can look at glass half full, half empty. The first round, we only had 62 countries, so there is a big improvement, but we are still not there. But the good thing about the data this time was there were more countries from low and middle income countries, more countries from Africa region. So there is that momentum that is extremely important. I think what we need to think in terms of, as we are thinking about the exciting innovations, and I mentioned that we should not be creating a divide, that these innovations are only available for high-income countries. We need to think about how do we take them to scale also in low and middle income, income countries, and how do we strengthen the health systems, to provide care and services.
Yeah.
And each of us has a role to play, and if we work together, I'm sure we would be able to, if not all targets, majority of that.
And you hit on something. It's kind of a perfect way to finish, I think, which is back in 2019 we were looking at 2030 and at 2050 in terms of the prevalence forecasts, and it always felt like it was somewhere far in the future. And all of a sudden, the 78 million forecast globally by 2030 is 4 years away. It feels like it's on our doorstep now. So I think what we're trying to do at ADI is to work alongside you to get that galvanization going, really keep this momentum going. So it's been, Dr. Tarinder, an absolute delight talking to you this morning in this beautiful sunshine in Geneva. The report is available to download from the ADI website, and this video will be made available on the ADI website and YouTube channels in the next few days. Thank you so much.
Thank you, Chris.
You're welcome.